Bismillahirrahmanirrahim. Assalamu alaikum. Let's discuss systemic antifungal drugs for mucocutaneous infection. Mucocutaneous infection caused by fungus. We have two drugs, Griseofulvin and terbinafine, to treat mucocutaneous infections. Griseofulvin, it is first we discuss its pharmacokinetic properties. Griseofulvin is insoluble in water. It is insoluble. It is fungistatic, not fungicidal, fungistatic, inhibit the growth of fungus. Derived from a species of Penicillium. Griseofulvin is derived from the species of Penicillium. It is used in the treatment of Griseofulvin. It is used for the treatment of dermatophytosis. It is used to treat the infection, to treat dermatophytosis. It is administered in microcrystalline form at a dose of 1 gram per day. Its absorption is increased when you give with fatty meal. Its absorption is increased when we give with fatty meal. What is the mechanism of action of Griseofulvin? At cellular level, its mechanism of action is unclear, but it is deposited in newly forming skin, deposited in newly forming cells, newly forming skin cells, where it binds to keratin. This Griseofulvin binds to the keratin. It may bond with the keratin in newly forming skin cells and protect the skin from new infection. It can't kill the fungus or cannot treat the it cannot treat the infection. Actually, it is the fungistatic. It protects the skin from new infection. It cannot treat the old infection. It is administered for 2 to 6 weeks for skin and hair infection to allow the replacement of infected keratin by the resistant structures. While if we have nail infection, then the therapies continue for the months. For nail infection, we continue the therapy for months, while for hair and skin infection, we continue the therapy for 2 to 6 weeks. What is the ADR of Griseofulvin? What is the ADR of Griseofulvin? We have allergics. It causes the allergic syndrome and serum sickness, hepatitis. Drug interaction with warfarin and phenobarbital. It interact with the warfarin and phenobarbital. Griseofulvin replaced by the new antifungal drugs like itraconazole and terbinafine. Its use is nowadays replaced by itraconazole and terbinafine. Now we discuss the next agent, terbinafine. Its pharmacokinetic properties are: it is synthetic allylamine. What is terbinafine? It is synthetic allylamine. Terbinafine is synthetic allylamine. It is oral agent used orally with the dose of 250 milligram per day. We use 250 milligram per day terbinafine. Terbinafine is used to treat dermatophytosis. It is used to treat dermatophytosis and onychomycosis. What is the mechanism of action of terbinafine? Like Griseofulvin, terbinafine, it is keratophilic. Like Griseofulvin and terbinafine, it is keratophilic. But unlike Griseofulvin, it is fungicidal. We know that Griseofulvin is fungistatic. It is fungicidal. It is also keratophilic. But it is fungicidal like azole drugs. Azole drugs, we know that azole drugs inhibit the synthesis of ergosterol. It also inhibits the synthesis of ergosterol, but azole drugs inhibit the cytochrome P450 enzymes of fungus. But this drug terbinafine inhibit the enzyme squalene epoxidase. Squalene epoxidase. This enzyme is inhibited by the terbinafine. This squalene epoxidase converts squalene into the squalene, which is the precursor of ergosterol, into the ergosterol. Squalene is a precursor of ergosterol. This squalene is converted into ergosterol by squalene epoxidase. This squalene epoxidase is now inhibited by the terbinafine, so the formation of ergosterol is inhibited, which led to the disruption of cell wall of fungus, and this disruption led to the death of the fungal cells. We use 1 tab OD for 12 weeks of terbinafine. 1 tab OD for 12 weeks. 90% cure onychomycosis. Onychomycosis is 90% treated by 1 tab OD for 12 weeks. The ADR adverse drug reaction of terbinafine is GIT upset and headache. These are the adverse drug reactions of the terbinafine.